Welcome to the State of Mind virtual speaker series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, 1 in 5 and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Hello, and thank you for joining me for the State of Mind series brought to you by 1 in 5 and MindPeace. My name is Bijan Ketabchi, and I'm an emergency room physician at Cincinnati Children's Hospital. Today, I'll be speaking with you about lethal means and suicide prevention. Let's start off with the state of pediatric mental health. Nationally, childhood suicide has increased 50% in the last decade. It is now the #2 cause of death in all children. Among high schoolers last year, 1 in 4 reported being depressed, 1 in 5 reported seriously considering suicide, and 1 in 10 children actually attempted suicide. These trends are getting worse across the board, from depression and persistent feelings of sadness to those actually attempted suicide. The rate is increasing. These numbers are even worse for those in the LGBTQ+ community, as they report 3 times higher rates of seriously considering suicide. Now let's discuss mental health locally. Each month in the ER at Cincinnati Children's, where I work, we see 500 to 700 children presenting for emergent mental health evaluations. Most of these relate to suicidal thoughts or attempts. Annually, the psychiatric clinics at Cincinnati Children's see over 80,000 visits each year. As you can see, the number of children presenting to our ER in a mental health crisis is steadily increasing. And let's discuss some facts about pediatric suicide. Among those that attempt suicide, half of them considered this before acting for less than 20 minutes. 71% considered it for less than an hour, underlying the fact that children are incredibly impulsive. Now, when referring to means of suicide attempts, medications are the #1 means. Firearms, however, are the #1 cause of suicide-associated deaths. Let's discuss lethal means more, and we'll start with firearms. Firearm suicide in the pediatric age range has increased 90% since 2008. Unfortunately, 82% of guns used in pediatric suicide are found within their own home. However, we do know that proper securement of firearms is associated with an 80% decreased risk of suicide or unintentional death. The American Academy of Pediatrics recommends that firearms not be kept in homes with children. However, if that is not a possibility for you, we recommend removing them while your child is in a crisis, even if temporarily. If that is not an option, we recommend that you keep all firearms locked, unloaded, with ammunition locked and stored separately. Other lethal means, such as medications, detergents, and cleaners, should also be stored locked in a cabinet or a container. We recommend removing all those that you are not currently using from the home, such as expired medication. It is a common myth that only prescription medications are dangerous. However, even things like Tylenol and ibuprofen can be incredibly deadly. Unfortunately, most families do not store their weapons safely. There's nearly 15 million households with children that are not following these guidelines. In fact, nearly 5 million children are in homes with guns that are both loaded and unlocked. And children are incredibly curious. When researchers surveyed families that stated that their children did not know where household guns were, 73% of children under the age of 10 reported that they did know where the guns were, and over a third reported actually handling the weapon. It can be difficult to discuss things like suicide and lethal means. There are many myths surrounding this topic. One of the most common myths is that asking about suicide puts that idea in their head. This is not correct. Discussion does not make it more likely. In fact, research studies have shown that depressed students who get screened about suicide are less suicidal than their counterparts who did not. Another myth is that there's no point in asking because if someone really wanted to, they wouldn't tell you. However, this is just not the case, as most are honest when they are asked. Even if a child does not want to talk to a mental health professional or physician, oftentimes they will hint and tell friends or family. Lastly, there is the myth that those who make threats of suicide won't really do it. They just want attention. And this could not be farther from the truth. Those who express thoughts are at the highest risk. 80% of those who die by suicide gave some indication to family and friends. Now, let's talk about how you ask about safety in others' homes. This can be a very tough conversation, so here are 2 potential prompts. I love how curious Billy is, but sometimes he gets into things he shouldn't. Before he comes over, can I just ask if dangerous items like medications and guns are all locked up? You can also take this approach. My pediatrician told us about a patient of theirs who died after their sibling accidentally shot them. Ever since then, I've been making sure all of our friends keep dangerous items locked up. I'd like to briefly touch on some policies supported by the American Academy of Pediatrics, or AAP. One that recently passed is the Supporting Children's Mental Health Care Access. This provides $80 million to pediatricians to provide them with access to telepsychiatry in places where they don't have access to large academic centers such as Cincinnati Children's Hospital. This is a huge win for children across the nation. Another bill that's currently in Congress is the Youth Mental Health and Suicide Prevention Act. This bill would provide millions of dollars in funding to schools, departments of health, and community organizations focused on tackling pediatric suicide. Another law that we support is extreme risk protection laws, aka red flag laws. These laws allow law enforcement officers, mental health professionals, and others to petition a judge to temporarily remove dangerous items such as firearms from the home when family members suspect that a patient is having a mental health crisis. We also support waiting periods for firearm purchases. As I mentioned before, children are incredibly impulsive. Now, let's touch on some resources. Nationally speaking, the new suicide hotline, 988, just went into effect earlier this year. This can be used by anyone in the nation at any time. In the greater Cincinnati area, there is a school-based program called Adapt for Life. This program has trained many counselors and teachers in schools where children can seek mental health care advice or access. There is also the National Alliance on Mental Illness of Southwest Ohio. This website here provides a variety of great resources, such as how to reach out to a mobile crisis unit or how to get in contact with Cincinnati Children's or other hospitals. For many adults, there is the UC Mobile Crisis Hotline. This number is accessible at most hours of the day. For Cincinnati Children specifically, there is our Psychiatric Intake and Response Team, or PIRC. You can call this number at any time of the day if you have concerns about your child's mental health. They will help you triage whether your child needs to go to the ER immediately for care, or they can help you set up an outpatient appointment for a counselor. You can also visit cincinnatichildrens.org/patients/suicide prevention for a variety of resources. As you can see here, you can access links to if your child needs help immediately. You can learn about topics such as depression and suicide in a variety of languages and other mental and behavioral health conditions. There is also a special section for children with special needs, such as autism. Now, what are our next steps? Awareness is key. Make sure that your friends and family are aware of the prevalence of depression and suicide in children and teens. Many people do not know these statistics, and it's important that they become aware so they can look out for the signs. We can also advocate for these policies at a local, state, and national level, and vote for politicians that support these beliefs too. And lastly, take actions within your own home. Throw out or lock up dangerous items. Have open conversations with your children and encourage them to discuss with you if they are having thoughts of suicide or depression. And also speak with your family and friends about keeping things in their home locked up. It's very important and it could save your child's life. Thank you for joining me for this State of Mind series. You can find additional resources and videos like this at 1 in 5 and MindPeace. You can also visit cincinnatichildrens.org/patients/suicide prevention for additional resources. Thank you again and have a great day.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1 in 5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.